Good afternoon and welcome to today's NCPDP webinar, Countdown to 2018, What's Next for Congress, sponsored by RX Recon. For Q&A purposes today, you can ask a question at any time during the webinar by typing in the question pane on your GoToWebinar toolbar. All questions will be addressed at the conclusion of the webinar as time permits. After the webinar, you will receive an email with a PDF copy of the slides presented today and any necessary handouts. Our speakers today will be Jen Steger, Director of Operations and Government Affairs for Horizon Government Affairs, and Nicole Russell, Manager, Government Affairs for NCPDP. I will now turn today's presentation over to Nicole.
Thanks, Wendy. If you want to advance to the next slide, please. Well, welcome everyone. As Wendy said, my name is Nicole, and we're joined today with Jen, who is one of our consultants at Horizon Government Affairs, to really give a good overview and layout of what is going on in Congress. It's been a busy week so far this week and what we can expect as the week wraps up. We're very pleased to report that the webinar today is sponsored by RX Recon, and if you have more questions about RX Recon or the products, I'm happy to take those questions either after this webinar or by via email at another time as well. With that, I'm going to turn it over to Jen to get us started.
Thanks, Nicole. Let's see, did the slide change? Wendy, did we have a top line item slide prior to this?
No, Jen, sorry, this is my first slide.
That's fine, I can just talk through it. In order to level set, I had wanted to pull up a slide that actually looks familiar from our first webinar, but kind of still rings true. So I can just talk through that. Top lines of what's going on from a political perspective. In general, an uncertain political environment is generating uncertain policy outcomes. We're certainly seeing this in the current health reform debate, but next steps after health reform is dealt with is at best muddy right now. The next best guess is, I think, tax reform, but that's still a ways off. In this environment, the key for Republicans in the majority in Congress is to manage expectations and then deliver on those, as well as on campaign promises from the 2016 election. It would be easy to expect major policy shifts since the House, Senate, and presidency are all in Republican hands. But as is summed up best by a lyric from popular play Hamilton, winning is easy, governing is harder. The GOP, however, needs a proven record of success on the governing front in order to have a track record for the 2018 and 2020 elections. We're already seeing looming elections shaping actions by both parties. On the minority side, presenting a unified front is critical while developing an agreeable policy agenda. As I mentioned, delivery on campaign promises is as much an issue for the administration as it is for the majority in Congress. However, the past months have been marked by complications on policy efforts and a seemingly unfocused agenda. There's a graph on one of the slides that I'm not sure we have that we like to call "We Hate Obamacare, but wait, don't take away the AHCA." As you can see from that graphic we had it, from the time the AHCA was passed and signed into law through implementation and until repeal became a real possibility, the unfavorables of the AHCA far outweighed the favorables. The trend has now flipped since there is no backstop, and public opinion is now trending the opposite as everyone faces the real possibility of change in the healthcare system. We'll get back to AHCA repeal and replace efforts here in just a minute, but while that is certainly getting the most attention recently, it is not the only must-pass legislation Congress needs to deal with, healthcare or otherwise. So that's where this must-pass slide comes in. Must-pass items from the healthcare world. There we go. Must-pass items from the healthcare world include CHIP, the Children's Health Insurance Program, as well as Medicare extenders. At the end of the fiscal year, CHIP, Medicare extenders, as well as the user fee agreements, or UFAs, and the current appropriations bills will all expire. So that's September 30th, 2017. Committees in the House have started hearings on CHIP and the extender package, showing they're looking forward past the current repeal-replace debate. The UFAs are actually even further along, and originally the prevailing thought was that they may be finished prior to August recess. They were passed through the House and out of the Health Committee in the Senate, but have yet to see action on the Senate floor. So that would be the next step for the UFAs, which it was actually ended up being called FDARA, the FDARA. In addition to the must-pass authorizations like CHIP, extenders, and the UFAs, the healthcare appropriations to fund all of these programs, traditionally some of the last appropriations bills to be taken up, will also need to be passed prior to October 1st. We do not, however, expect these other measures to be taken up until repeal or replace is more settled. In the non-healthcare space, the federal government is looking at potentially needing to raise the debt limit in the fall, as the United States is expected to hit our current credit limit in the October-November range. And back to appropriations, as the Senate focuses on health reform debate, the House was actually in late last night debating amendments to what they called a minibus of 4 related bills to national security: defense, military construction, veterans affairs, energy and water, and ledge branch, in addition to an appropriation entitled Physical Barrier Construction, which is meant to secure our southern border. As promised, the next few slides provide additional details about the House-passed American Health Care Act, as well as the Senate-passed the Senate-debated Better Care Reconciliation Act. For the American Health Care Act, that was actually passed in early May by a small margin, mostly on partisan lines, passed 217 to 213, but was deemed dead on arrival in the Senate. The Senate was not going to take up that language and was expected to amend it, which is what the debate is on right now. The Congressional Budget Office, or CBO, estimated that the AHCA would reduce direct spending by $1.1 billion over 10 years. However, there would be an expected 23 million more uninsured individuals by 2023 than if current law was kept the same. You can go to the next slide. The next slide is, there we go. There's a lot of information on this one. A few items to highlight on what the AHCA, the provisions in the AHCA. It would have changed the tax subsidy structure starting in 2020 to an age-based credit that would not be pegged to premiums. The impact of that new credit would vary by age, income, as well as geographical location. The age rating bands would be changed from the current 3-to-1 status to 5-to-1 status, meaning insurers would be permitted to charge older enrollees 5 times more than younger enrollees instead of the 3 times more that is under current law. Subsidies would also be able to be used off exchange plans versus just on the public exchanges as is currently stated. In addition, $115 billion over 10 years would have been provided for state stabilization funds and to improve the marketplaces. Most of the ACA tax credits would have been rescinded under the AHCA, and the structure for Medicaid funding would change in 2020 to a per capita structure. Lastly, the penalty for the individual and employer mandate would be zeroed out under this plan, essentially taking out the teeth of the mandate. So the mandate would still be in code, but it would not be enforceable. So let's shift now over to the Senate package, or packages, since we've had 3 versions since just last month. The Better Care Reconciliation Act is going through, the Better Care Reconciliation Act is going through the Senate reconciliation process. which means provisions must satisfy what's called the Byrd Rule. And the Senate parliamentarian determined just recently that many would not satisfy those requirements, including the policy giving states the option to sunset essential health benefits and Medicaid starting in 2020, the provision instating a waiting period for those who do not maintain continuous coverage, the change in age rating bands that was included in the AHCA, the association health plans policy that was included in the original package, and the provision providing states an option of a lump sum payment per capita in Medicaid rather than a per capita payment. So we can go over to the next slide. Thank you. Here are just a few of the major provisions in the Better Care Reconciliation Act. Again, this is the latest version. We have, like I said, gone through a couple of different iterations as to what's on the floor. The revised legislation increases the amount of funding available to help combat the opioid epidemic to $45 billion. The original amount was $2 billion for the next 2 years. This package increased it to $45 billion over 10 years. It also included an additional $70 billion to assist states in stabilizing their marketplaces and reducing premiums. That is in addition to what the AHCA would have done. Revised language includes a provision allowing funds in health savings accounts to be used towards paying premiums, which is a change from current policy where your HSA you cannot use it to pay premiums. You can only use it to pay for qualified medical expenses. And then the Cruz Amendment, which was in the second version of the bill, was taken out, would have allowed insurers who sell at least one ACA compliant plan to also offer plans that are considered skimpier coverage. That was taken out in the third iteration of the bill. CBO also put out an estimate on this bill, and on July 19th, they published their estimate that's saying while the legislation would decrease deficits by $473 billion over 10 years, 32 million more Americans would be uninsured in 2026 relative to under the current ACA law. Then we can go to the next slide. This is the kind of what we know today. Like Nicole mentioned, it's been a busy week in DC, and the Senate has been on the floor debating motions and amendments and to the BCRA. So just to kind of go through a couple of those, on July 25th, so that was on Tuesday, the Senate passed a motion to proceed to even begin consideration on the topic. That motion was tied 50-50, and Vice President Pence broke the tie on Tuesday afternoon. So that started 20 hours of debate. We have about 10 hours left as of this morning. As expected, the 2015 repeal, as well as, so the straight 2015 repeal, as well as the Better Care Reconciliation Act, in addition to amendment offered by Mr. Portman and Mr. Cruz, the amendment we just talked about a minute ago, were put on the floor, but they failed on a procedural vote from some budget points of order. Just yesterday, they had, I believe, 3 series of votes. All of those failed to even get to a majority, much less the 60 votes needed, including a repeal amendment offered by Senator Paul and 2 procedural motions to send the entire bill back to committee to kind of be redrafted, rethought, and then they could bring it back out to the floor. Like I mentioned, there are about 10 hours of debate left on the package. We expect at least 1 series of votes this afternoon, around 2 to 2:30, on an amendment offered by Senator James from Montana. And our best outlook at this point, though, as I've always said, this could change, is we expect a what's called a skinnier package to be the best chance for the Senate to pass something, at which point the House and the Senate would go to conference. So the AHCA, which is the House pass, and whatever the Senate is able to pass would go to a conference committee. It would then, all those differences would be hashed out, and it would need to go back to both houses and be passed again by both the House and the Senate after a conference in order to make it to the president's desk. So like I said, that they are expecting votes today, so we don't know exactly what is going to be passed out of the Senate or where it goes from there, but that is our best guess as of 12:15 Eastern time. So at this point, I can turn it over to Nicole for the advocacy update, and I'm happy to do questions at the end.
Thanks, Jen. That was a good overview and lots of information on what's currently going on. Well, another issue that remains a priority for both Congress and the administration is the opioid epidemic. And as we mentioned during our last webinar back in March, President Trump has established a commission led by Chris Christie and they're tasked with outlining federal initiatives to curb this epidemic. Well, so far the commission has met once, and they are scheduled to meet again this coming Monday. The commission was directed through executive order to publish a report within 90 days on their proposed strategies to effectively curb this epidemic. Well, that deadline has passed. It was June 27th, and there is still no report that has been published to date. Commission members do report that they are diligently working on it and that they just need more time to finish it up. So we will be watching for that to be published. NCPDP did submit information on our PDMP model and prevention efforts to the commission, and we will also be listening in to the teleconference meeting that is scheduled to be held on Monday. In Congress, we're seeing this remain a top issue as well there. Jen just did a great job overviewing the ongoing healthcare debate, and much of that debate has centered around the issue of Medicaid expansion rollback, and that's largely because rolling back Medicaid coverage would leave patients without access to treatment. So states that have expanded coverage, now they have more individuals in that state that have access for treatment and recovery programs that didn't have access prior to expansion efforts. So if you roll back expansion, you're going to have this population that is left without proper treatment and recovery, and what happens to those individuals in that case. So that's where, when Jen talked about $45 billion being added to the Senate healthcare reform bill, that's kind of why, to fill in that gap for this population. Switching gears to funding bills, Congress did pass, since we last had our webinar in March, they did pass their 2017 funding bill in May, and they did fully fund CARA and the 21st Century Cures bills, which contained provisions relating to treatment and prevention efforts for prescription drug abuse. And we're seeing that remain a priority as committees are working on their 2018 funding bills. In the House, the HHS and Labor funding bill has passed out of committee, and that would again fully fund these provisions for the next year. Next slide, please. So continuing that discussion, we just completed our advocacy tour where we continue to talk to policymakers about our PDMP model. The atmosphere in DC is different. It was different last week when we were there, in my perception. There seems to be more of an urgency to do something on this issue, not just continue to talk about it, but to actually put some action into place. I felt that in both congressional offices and in meetings that we had with the administration. We also spent some time meeting with several stakeholder groups while we were there, and we and our message were very well received. You've heard us talk about NCPDP participating in an industry-wide coalition called the National Patient Safety Network, where more stakeholder groups are coming together to work on the issue collaboratively. This sends a very strong message to policymakers. The industry wants to be part of a solution, and it's ready to help implement one. The discussion and the focus of the coalition is about implementing NCPDP's solution through the use of a central facilitator or patient safety network that's outlined in NCPDP's white paper and our facilitator requirement documents, that were produced by Work Group 9. We just see that we're continuing to make gains in this area in a collaborative effort amongst the industry. And it's really exciting to see that start to happen. I'll have more information to share with you all during our advocacy update next week at Work Group for those of you that will be attending. Those of you not attending, my slides will be in the downloadable information. So with that, that concludes our presentation today, and we're happy to take any questions that you may have.
We will now start the Q&A portion of our program. Remember, if you can ask a question at any time by typing in the GoToWebinar question pane on your window. If you pull your toolbar out on your GoToWebinar, there is a question area and you can chat into that question area. At this time, we don't have any questions. Today's webinar was sponsored by RxRecon. RxRecon, Nicole, would you like to talk a little bit about RxRecon?
Happy to. RxRecon is our product to give you insight on healthcare legislation and regulation. So it is hosted on our website and it is powered by Fiscal Notes. You have real-time access to state and federal legislation, as well as state regulations. It is customizable, so you can pull reports that meet the needs of your individual organization and your policy areas of focus, and send those on to your colleagues. And it is real time, so you are also able to get that information in front of you as you need it and as actions are happening both at the legislative and regulatory level. We also publish a weekly newsletter with news on what's going on at both the federal, legislative, and regulatory levels as well. And we have AHCA help supplement that and keep us current with what's going on, similar to how Jen helped us present this today.
Thank you, Nicole. We have our first question. Is it just assumed that there will be 10 more hours of debate on the bill, or is there a set amount of time that debate is allowed?
I can go ahead and take that. On the Senate floor, it is 10 hours of debate, but it's not necessarily 10 consecutive hours. So they will determine what counts towards the time of debate while they're on the floor. Since Tuesday afternoon, they've only used about half of their time. So once that next 10 hours runs out, then they would vote on whatever pending motions are currently on before them.
Thank you, Jen. And since we have no further questions at this time, I'd like to take a moment and share with you, we have an upcoming NCPDP webinar on Part D and the CMS scrutiny in 2017, which will focus on the Medicare Part D audit on August 29th. And also want to bring to your attention that our educational summit is upcoming this November in Long Beach, California. Registration will open after August work groups, so be sure to check out our website for other educational programs. And I'd like to thank Nicole and Jen for their time and expertise today and that great update. Thank you all for your participation and have a great day.